highlight questions and reflections that have stemmed from my dissertation research that I've done here at Stanford over the last few years. So I'm just going to brush the surface of the actual research. So let's see. Okay. So what do people really want when they're at their most vulnerable? So the work that I did was with Lucille Packard, with their stem cell transplantation unit, and I worked with children and their families who are undergoing transplants, living in isolation for a few months at a time. These are very difficult situations that they'd gone through. And I conducted a need-finding study to understand how we might best improve their well-being mentally and emotionally while they're there. So we all have human needs. This is the perspective that I took in looking at the problem. When they're met, we have well-being, and when they're unmet, we have suffering. Things like physiological needs, safety, relatedness, connectedness, control, competence. Maslow's hierarchy of needs might come to your mind. And so I wanted to understand deeply what patients and families really needed to improve their well-being. And so I framed it as having to really look deep and find their core needs. And this is something that I would say is probably better fit for a mental health professional, someone who would be able to deeply get into the mind and the human experience of an individual and understand their specific needs. This is a very labor-intensive process, and even what I did, I worked with palliative care. I had a specialist, the founder of palliative care, who ran sessions with me with patients. She's a psychologist, and we gave them opportunities to open up. But this is a very addressing psychosocial needs and support is a very labor-intensive, individualized process, and not enough people, in my opinion, are receiving adequate support. And I think this needs to be kind of rethought, which I'm going to get into. But how might we think about taking this process and making it more effective and efficient? And it's a tricky question because, again, empathy is necessary in that equation, and emotional support is necessary. That takes time. Building trust takes time, and you can't take that away from a process. So a few things that we might be able to learn, at least from what I went through, is just a few perspectives here that I can offer. One is creating a protected space. And so we held these sessions with families up in the hospital school. It was a very comfortable environment for them, and we made this very personal. We referenced their experiences in a little card. This is a handmade gift that I had made for each of them, each of the participants, and we made these kind of customized cards, game cards with prompts, and you could look at these as like psychological prompts of questions that we asked them, easy ways to kind of think about their experience and reflect on them. And someone said it was really sweet. I teared up seeing the personalization. And this is just one of many factors and ways that we crafted this session. And we were there in person, just to be clear. We created an easy way in, or rather I should say out, for them. These are a few examples of some of the cards that we used. One that I'll take through the presentation here is a robot that takes care of them. And we frame this as them helping another person. So these are some psychological slants in making it easy to communicate. How can you think constructively about the situation you went through? How can you really dig deep and express it emotionally, but also think of it in a positive way and how to make it better for somebody else and project this onto somebody else? And it seemed to be an efficient way of working through the experience that we went through with them. And so a robot, what does it do and when is it used? Having these vague questions. If anybody's from design here, some of these ideas came from, well, art therapy within psychology, but also design or cultural probes as well. And people commented that it was a comfortable way to start and it put them at ease. And so we can consider this tangible reflection. And is there a way we could digitize this, for instance? And again, not to take away from the human component and the emotional component, but perhaps as preliminary work, homework, so to speak, in between sessions with the therapist. And these are some examples of projects that folks made. We gave them about half an hour to work on their projects, and just to really get deep to a place where they could emotionally, intuitively work through their experience and get to a place where then we could put it into words and structure it. And so, there are clay robots, an invention for a food clock server, a gift box for somebody. And we really got in some insight into the depths of their experiences. It was a very emotional and difficult time for them, but it was also, in terms of the session, but it was also very rewarding for them as well. And positive, it turns out. There are a lot of positive emotions that we measured in the end. And so about the robot, when we asked this boy, he was about 16, about what this robot did, he said, I don't know, I wasn't really thinking about it, which was part of the purpose. And remember, we're working with children here, including teenagers who are still children. And giving you hope, he said, eventually, you know, someone to look up to. And this was with the help of the psychologist getting him to talk about it. Someone you can play with, and that'll be there for you. He was referring to his father, who he eventually called his hope robot, and his father was with him there in the session, and they had, you know, this back and forth understanding between each other. A mother recounting the chemotherapy treatment that her daughter had, who was screaming that she was dying and thought her eyes were kind of bleeding out. She thought, and that wasn't actually happening. And the mother screaming, over my dead body, you're not dying, when the daughter's screaming that I am. And then later, that same girl remembering when she stepped outside of the hospital after months of being in isolation, seeing the trees, feeling the breeze, and feeling like she was actually alive, and saying this is a very deep moment for her. And so that level of information is extraordinarily important, and it is rich, and it's very helpful for designers especially to get to that level and get into the context of a situation. But in designing psychological interventions, it's also important to have, in my opinion, to have a scientific slant as well, in terms of what are we designing for, what outcomes, and how can we understand what is and is not working within the design, and how can we tweak that. And so looking at this from a data perspective and taking the interviews and analyzing this, we did a thematic analysis, which is common within psychology work, even within design as well, to some extent. And this took, you know, human interpretation. There were 4 of us who analyzed these and tagged them with themes. And then we could get a picture of, to start thinking about moving from just an individual one-on-one interaction with someone to a personalized kind of psychosocial care to broader psychosocial care for groups, which is a bit tricky, and so it's something to work through, but this could help move in that direction. And so just to jump way, way, way ahead to what our common core needs were that we identified, and to be clear, we also did another study that fed into these core needs with the psychosocial team that included the janitor, that included the nurses, the psychologists, the physicians, the faculty physicians, hospitalists, and this was around 35 folks on the multidisciplinary care team who also gave input when we interviewed them. And so this is taking all of this, synthesizing this into emotional and mental strength, social relatedness, autonomy, connectedness, and normalcy. Now this is very abstract, but it's meant to be. So somebody once commented, it was actually a child psychiatrist, who said, you know, it's interesting, we think about, you know, we have the DSM for mental health, and we think about specific diagnoses. But what about for psychosocial support? You know, can we have a similar ontology of specific needs that can be addressed? And these are shared amongst, you know, people in different situations. These are common basic human needs that we all have, and that are strained in different situations. Another way to think about taking a scientific approach would be to definitely make sure to measure outcomes and finding the right outcomes. And this often, I would think, would mean coming up with what is appropriate for a specific study. And so coming up with some. So what we did was the sessions that we held weren't meant to be an intervention in and of itself, but we thought it would have therapeutic qualities, and so we wanted to measure that potential. And so we looked at psychological needs, and we just picked out 6 of them. And one that was we picked 6 that could be relevant, and we weren't trying to work towards self-actualization, but it was interesting to us that of the about 18 people who had responded in these surveys, after the sessions, when we asked, you know, over the course of this 1 to 2 hour session, how much did you feel a deeper sense of purpose in life? 72% of them said, on a scale of 8 to 10, you know, that was how much. And then you can see here all of them, up to 89% of folks, even relatedness with the people they were working with and for. And we were strangers to them, so keep that in mind. And then this you know, approach to taking a research-based approach to measuring what you're, or asking the question at first, you know, what is your hypothesis? So if you're doing a research study, this would mean, you know, structuring it. You have this design, is being emotionally coached through an experience, for instance. Does that affect, say, quality of life or anxiety or psychological distress? These are common outcomes that you will find in literature studies today for psychological interventions, but there could be more specific things, and the design, of course, would be more specific as well. But the idea of constantly asking, measuring it, and tweaking it in a more informed manner. And then to sum this up, you know, if this is if this is necessary, how might we rethink and redesign our system of psychosocial support? Do we need to do this? What things can we redesign, new perspectives we might be able to have? I think personally, when I talk to patients, there's not enough psychosocial support. There are not enough resources being put towards it. You might have a beautiful building that you're being cared for. And I'm an architect. I was trained as an architect. I get it. I love buildings. I love spaces. Environment is extraordinarily important to me, and I'm affected by it, very sensitive to it. But you might have people suffering within those beautiful buildings because they're not getting the appropriate amount of personalized, individual, person-to-person psychosocial support that they need. And it might be there, but there might not be enough resources for it, or it might not be appropriate for that person when you try to provide a solution that is that individual for the masses of your hospital population. And so these are questions that I posed. I thought we were going to have time during the sessions to discuss, but we might have to hold off. So.